Hello students, this is Dr. Praveen Tripathi, Faculty of Psychiatry at Cerebellum Academy, and in this video I'll be discussing about the strategy that interns can use for the preparation of NEET PG 2024. Now we are fairly sure that NEET PG is going to happen in 2024 and we believe that it would happen somewhere in January. In the webinar also we got to hear that till next one gets implemented, interim NEET PG will happen. So in all likelihood the interns would be appearing for NEET PG 2024. Now in this video where I am talking specifically about interns, there are certain differences. First of all, as you see this video, you are around 6 months away from the examination, presuming that it is going to happen in January, right? Now 6 months is enough period to prepare for the examination and also ace it. It is not a lot of time of course, but the time is not too less either that you cannot study. So it's enough time to study and crack the examination. I believe that this year interns should give extra attention to their studies and they should try to prepare well for the NEET PG examination. Not trying to scare you here, but see there are going to be a lot of uncertainties in the future. We do not know what NMC will do, what will happen to the next one, what will happen to the next two. We do not know, whom they will ask to appear for all those examinations. So I think it's important that we give out our best effort in the upcoming exam. Traditionally what we have seen is that interns, a large number of interns believe that let us do the internship properly and then we can study later on. It used to be a fair approach. There was nothing wrong with that. But this time I think we should try to give our best shot to the upcoming examination. If we can get selected and if we do study properly, we will get selected. We will be able to avoid all those uncertainties. Now, if you decide to study, I think there is no time to waste. 6 months, as I said, is not too less a time, but we have to use every single day properly. Only then we can expect a good result, right? When you talk about NEET PG entrance examination, the three fundamental or the three pillars of the preparation are always completing the syllabus in time, revision at least 1 or 2 times, and a strong hold on PYQs, right? So your interns, you would be going for duties also, you would be going for OPDs also. So trying to complete and having at least 1 revision and second revision of certain topics should be our goal. And throughout this period, we should try to focus on the PYQs, previous year questions, so that we do not miss out on any repeat question. So this has to be the broad strategy. And so as far as the mission NEET PG is concerned, we have made a structured plan. We have made a structured program. You just have to follow the schedule. Even if you have not studied enough or studied significantly till now, even then if you follow the schedule, you would be able to finish the course in time and you will have enough time for the revisions also. And in case you have completed a subject or 2 or maybe more subjects, in that case also we can follow this program using a mix and match approach. What do I mean by this? Say you have completed certain subjects using either Cerebellum Academy main videos or say videos of some other platform. And if you have a strong hold on those subjects, I would say that you can just persist with those videos and just revise them. But if you have either not completed any subject or if you have completed certain subjects but do not feel really confident about them, in that case we can focus on the live lectures that would be taken in the mission NEET PG. Now these live lectures are going to be comprehensive lectures. It's not going to be crash course, right? I'll show you later. We'll be teaching for almost 500 hours in live sessions. So it's a comprehensive course. And being an intern with 6 months in hand with your duties and everything, I think live lectures would help you a lot in completing the course. And they are not really concise. They are comprehensive, but not too comprehensive, not so detailed that you cannot complete the course, right? So it's a good trade-off between the two things. Now we will use live lectures, and for certain subjects we can use rapid revision videos. You can also do another thing, use live lectures, make your notes, or even better, use the printed notes and make additions in those printed notes, and then you can use either those notes for revision or you can go with rapid revision videos for revision, right? So you can have a mix and match approach. For certain subjects you do the live lectures, use their notes. For other subjects, you can use rapid revision videos. As of today, since we are 6 months away from the examination, I think we should focus more on the live lectures, and later on, even if you are not able to revise certain subjects, we can use rapid revision videos for the revision, because the content is quite in sync with each other, right? And later on, we can always use the BTR videos of Zainab ma'am for quick revision. Later on, Zainab ma'am will be coming with what is called as Ultra BTR, what she calls as Ultra BTR, even more concise, even more high yield. So those things can be used later on in the preparation. But as of today, live videos and rapid revision videos also later on in the preparation. So the completion of course will happen in 2 phases. The first phase would be clinicals. Even in clinical subject, we'll be starting with the short subjects. For example, we'll be starting the program with psychiatry. I'll be starting with psychiatry. I'll be taking psychiatry in 14 hours, right? So 14 hours is a significant period of time. 14 hours divided over 3 days. 14 hours divided over 3 days, right? Similarly, later we will have Dr. Apoor taking ortho, Dr. Zainab taking radio, Dr. Srinivas taking derma, Dr. Janvi taking anesthesia, and the bigger subjects like medicine, surgery. So medicine would be completed in 50 hours. Dr. Dilip has done a fantastic job in his medicine rapid revision videos. 50 hours for medicine, 50 hours for surgery in 2 sessions, 2 different sessions. Then we have OBG almost 35 to 40 hours, pediatrics almost 25 hours. And then we will have the second phase. We'll have first and second prof, starting with pharma, GRG sir, then Spur sir, Vivek sir, all the great teachers that you know of. That will happen in the second phase. So as I said, it's a comprehensive program, more than 500 hours of lectures. Now this is important. Every subject would be followed by a detailed test, a test and a detailed discussion. So for example, I will teach psychiatry, then I'll take a test around 75 to 100 questions and then a detailed discussion. And in these tests, we'll be focusing also on the clinical questions that are being increasingly asked nowadays. In next one, it's clear that the clinical questions would be forming the majority of the paper. But even in the NEET PG and INI CT, over the last couple of years, what we are seeing is lots and lots of clinical questions are being asked. So in the program, we will cover the PYQs along with the lectures and later on subject-wise tests. Alright, grand test would be there, doubt clearing sessions. So every day we are planning to have around 5 hours of lecture, 4 to 5 hours, starting 5:30 p.m. when you are already back from your hospital. So after every 2 hours, we'll take a short break, say 15-20 minutes break, and then we will resume the remaining 2 hours or 2.5 hours, whatever it is. In case you have a duty on a particular day, if you are not able to attend the lecture, that lecture would be kept as a recorded session and you can watch it later on. But all those lectures, live lectures that you can attend, you should attend, right? Watching a recorded lecture takes more effort, you need to be really motivated. But when a live lecture is being taken, if you just sit, if you just keep your eyes open, if you just keep your ears open, if you keep your mind open, things will percolate down, right? So it becomes easier to follow a live lecture in comparison to a recorded lecture. And that is the whole idea behind this program, that let's complete everything in live lectures so that students who are having difficulty in following a schedule, who cannot motivate themselves enough to sit with videos, and who are lagging behind, not able to pace the course properly, they'll get massively benefited. Of course, mentorship is there. So this is the broad program. We'll be starting with psychiatry, 3 days, followed by a T&D. Then Praneeth sir taking ENT for 4 days, followed by a test and discussion. Apoor sir, Zainab ma'am, Rana ma'am, a wonderful gynae teacher, in 2 sessions. Srinivas sir, Anand sir for pediatrics, Dilip sir for medicine, Janvi ma'am for anesthesia, Amrit sir for surgery, Gaurav sir for ophthalmology. So the clinicals would be done by September 8. Now please mind you, these are not only subjects, they are also subjects along with the tests, so that we have some completion here. And then we will start with the phase 2, starting with the GRG sir and ending with Vivek sir. So by November 2nd, by the beginning of November, we would be done with the course, along with the T&D, along with the test and discussion, what we call as END, exam and discussion, right? And then we go to the phase 3. So we'll have November, and we will have December, and we'll have January. And in this November, December, and probably half of January, we'll be doing the revisions, BTR sessions by Zainab ma'am, and of course PYQs and GTs will be taken. So a pretty structured course. You just have to follow it, and you'll have a great chance of clearing the NEET PG examination. And if you are our student, Cerebellum Academy student, it's complimentary. You don't have to pay anything. It's a part of your subscription. We have been very clear from the day one that our premium students, whatever we do, they get it complimentary. And for students who are not a part of Cerebellum Academy as of today, you can become a part of Cerebellum Academy. You can do two things. You can either join the Mission NEET PG course, or you can go for a premium subscription, right? What is the difference? There is actually no difference except for duration. This one is for 7 months and this one is for at least 1 year. Now this live course, it would be a part of both. Also your main videos, both English and English, your rapid revision videos, both English and English, your BTR by Dr. Zainab, your QBank, all of them would be a part of both of these. So the only difference between the Mission NEET PG course and the premium course is the duration. Mission NEET PG is for a lesser duration. So many students were actually asking that give us a course for a shorter duration. We don't want 1 year course. So for them this 7-month course was launched. And of course the charges are lesser. This is rupees 19,999. And premium course, if I am not wrong, for 1 year it is I think rupees 27,999. I am not really sure about it, but I think this is the charge. These are the charges. So students, in the end, I would just want to say that let's give our best shot to the NEET PG examination 2024, and enough time is left. If we play it smartly, if we complete the course at time, and if we do the revisions, there's no reason why you cannot crack the examination and get a great rank, get a good seat of your choice. And we'll be starting on 2nd of July. Follow the program, do the classes, do the PYQs, do the GTs, follow the BTRs, and I think we have enough material structured in such a way that you can finish it all and get a great rank. So hoping to see you in the class on 2nd of July, and all the best.